All right, let's get started. My name is Corinne Walda. I'm the Senior Director of Economic Vitality at the Boulder Chamber. I want to thank you for joining us for this week's Boulder County cross-industry update related to the pandemic. We're going to hand it over to Lane in just a minute, but as a reminder, please put your questions in the Q&A function. If you put them in the chat, it's hard for me to record them later, and we do get a lot of people on these calls. So without further ado, I'm going to give it over to Lane Drager with Boulder County Public Health, and I apologize now if I have background noise. I am outside a coffee shop in Boulder County. The virtual world allows us to do this type of thing. So you're now with me outside of a coffee shop this week. So take it away, Lane.
Thanks, Corinne, and thank you all for joining. I'm going to share some of our current data with all of you. Again, all of our information, as things seem to be ever evolving, are all available on our website, and we'll make sure that those links are shared with you later. So we have seen a downturn in cases, which is very good sign. Some of that is an artifact of reporting timing, and then in the last week, certainly around the Thanksgiving holiday, we've seen a decrease in testing overall. I'll show that in some of the other slides, but that could also be an artifact of it. So we'll continue to watch this, but we hope that this is a positive trend. And as you'll see, that trend is something we're seeing across Colorado. That being said, those numbers that we're still showing are dramatically high. So we need these to continue to drop at this rate for a considerable amount of time for us to really get back to a good place. The difference in numbers, I don't know if I've mentioned this in past slides, but we have our local data, which is the most accurate. And then this slide is using larger CDC data, so where they're tracking this across the country. So there are delays in some of that. So there's some nuances where you'll see different numbers between what we're showing as our current rates versus what the CDC is showing. But eventually they all do work out. We are also, as we're seeing our case rates drop, we're seeing that trend obviously here across the age demographics. It's very positive to see that 0 to 11 dropping. And we hope to see those vaccination rates increase so that further stays low. But we are seeing across the board some declines there across our trends. And again, a huge change for that youngest age demographic. And then we still are seeing disparities. This has dropped pretty significantly though from where it was in the last month. So seeing about 18% of our cases among the Hispanic Latinx community, who again represent 14% of our overall population. So this is a positive thing to see. Even though our overall cases are down, we still want to see those rates come down as well. So that's a positive. And then we had seen pretty significant numbers in Longmont, as you can see over that past month when we were 40+% of our cases from Longmont. That has decreased considerably, and now we're down to 31% of those cases in Longmont, 27% in Boulder. So that the case count over the last week, 159 cases in the city of Boulder, where we were at 236 the prior week, 188 cases in Longmont, and we were at 294 the week prior. Lafayette, Louisville, and Superior, we had 97 cases, and we were at 160 the prior week. And then our other municipalities in unincorporated county, we were at 154 cases, and we were at 161 the prior week. So not as much of a change in the other municipalities. Again, we have seen a decrease in testing. Some of that may have just been people holidays, traveling, not focused on it, although that's when we actually want to see people increase testing. So as we head into additional holidays this month, if you are feeling ill or just to be extra cautious, it is wise to do those tests before you have large gatherings. Just to give you a sense of what's happening within the hospital system, while we've seen our case rates decline, we've still seen an increase in hospitalization. So again, people not testing, not identifying disease doesn't mean the severity of disease has decreased, and we're seeing that. So we saw actual increase there. The bed availability for the North Central region was still fairly stable, but very low. So that still remains a concern. And that's again something that we're continuing to watch very closely. Right now, there are 90 people hospitalized with confirmed COVID-19 in the Boulder County system, and we only have 12 ICU bed available. So again, that continues to be a big concern on that, and similarly across the state. We've had 51 deaths since May of this year. So it's important to know that we're seeing a higher trend than what we saw in 2020 at this time. So that is concerning. And we also know that we have a vaccine that we did not have last year. So it just shows how the Delta variant has been so significant and something that we're, again, very concerned about. 59% of the deaths among Boulder County residents have been associated with long-term care facilities, but 59% is not 100%. So for folks thinking that this is only impacting elderly and long-term care facilities, it's not. It is still significantly impacting older demographics, but we are seeing deaths in younger demographics as well. As I mentioned, COVID testing dropped pretty significantly in the last week, but unfortunately the positivity rate increased. So again, the lack of people identifying disease and reporting it, so our case rates going down may not be the only indicator that people need to pay attention to when we're seeing our hospitalizations increase and our positivity increase. We know that the disease is still of pretty significant concern. 7%, for just to give you that relative sense, we were down less than 1% early in the summer, kind of that May, June timeframe. So we are dramatically different place than we were earlier this year. Vaccinations, here's kind of where we're at. We're not seeing dramatic changes there, but we're at 69.1% of the total population are fully vaccinated, 72.1% of the eligible population. So again, as we have increased the age demographics that are eligible, those numbers have now dropped a little bit from where we were reporting previously. I don't know that I have the age demographic slide, but just to give a clarifier for that good question last time, for those that might be returning, when we saw those percentages that were over 100%, those were based on our actual populations. We don't have an actual count, so we use the census as our age demographic populations, and those are not obviously accurate. So when we see more cases than what the census tells us we have, that's how that percentage was calculated in the last presentation. So just wanted to clarify that for anyone, so it's not on this slide, but just in case you see those into the future, and I'll be able to answer that question better into the future. Here's kind of what's happening with boosters. Definitely seen big uptake for our older demographics, and it's certainly not as much for younger demographics. And for the youngest, they may not even be at a 6-month point. So that's another reason why we're going to see that be a little bit lower, but something that folks need to be considering if you are eligible for a booster. And we'll talk more about the ongoing evolution of the disease here in a minute. Some important resources that we've shared, repeatedly. And so again, just keep pointing folks to where you can get good, accurate information instead of just random searches for information. And we'll talk about Omicron variant. So this is the newest variant that's on watch. So this variant has, the reason it's of concern is the number of mutations. So each one of these variants has mutated from the original virus that we were dealing with. And the more mutations, the more chance there is that it has changed how it behaves, both in its disease, how quickly it can spread, possibly in the severity of the disease people will get, And then the most concerning is what kind of resistance to vaccine we might have. So all we know so far from other parts of the world where this has been identified is that it spreads very quickly. So that obviously is very concerning. We don't know though about severity, and we don't know about vaccine resistance. So we'll continue to investigate those and share information as we find it. You'll probably see it in the news media as quickly as the things come out. When this PowerPoint was first created, I've already had to change the last bullet where we have not detected this in Colorado and not detected this in the United States. That has already changed this week, and it has been detected in the United States. And, you know, it is likely here, just we have a very global population. People move around this world very easily and quickly. So it is likely in the US beyond just the case that's been identified in Colorado or in California, and certainly could be in Colorado already. We'll continue to look for that, and then variant typing will help us once we identify that. But those are the concerns, is how quickly this might spread, and we'll see how if it does outcompete the Delta variant, which is what happened. The Delta variant outcompeted the other variants, and that's why it has been our dominant strain that we've been dealing with. I guess the good news related to variants is our strategies don't change. We really need people to be vaccinated. We want you to really be thoughtful about how you interact with folks. You know, we know outdoors is much lower risk than indoors. So where you can take activities and things outdoors, and especially Korea is a great example. It's ridiculously warm in December, so take advantage of that. This is the one positive, I guess, of global climate change, is that we're seeing temperatures that are unseasonably warm. So at least that gives us something to work with. And then obviously the social distancing when you are in larger groups, both indoors and outdoors, but especially indoors, and wearing masks. You know, obviously we have our mask order, but that is an additional strategy that will help reduce risk. So please make sure that you're paying attention to all those things, because this is our recipe for success. And in addition, it also is a recipe for success at combating flu. And I'll talk a little bit about that here in a minute. This is some data that the State Health Department has shared. So for those folks, you know, it is important to know why we've addressed schools, why there was masking orders in schools, why this has been an important focus. Is for folks that don't believe children can get sick, they can. And, you know, the majority of cases in Colorado have been associated with school outbreaks. So you can see that's 40%, a huge significance, even more so than congregate settings and things like jails where there is very closed confined spaces and super high risk. Schools, obviously a lot of people in indoor settings. So that has been a significant piece. We're faring very well compared to some of our peers, but still 108 in Boulder County. Pagosa Springs and San Juan Basin has actually gone back to remote learning because of issues that they're having, and they did not require masks. So those are just important pieces, and why some of the strategies, while people have not liked them and they've been inconvenient, they have helped us prevent some of those other more unfortunate steps. Flu. So again, another respiratory disease that people are more familiar with, but it is circulating in Colorado, and it is expected to increase during the holiday season, both because that's typically when flu is most active and people are congregating. So again, same risk factors as what we've been addressing with COVID. It's important to note, last year we had a very nominal flu season, likely because of people's efforts to prevent spread of COVID. It also prevents the spread of flu. The CDC has now issued a health alert network for flu. So that's something that goes out to all of our healthcare providers. So people will be on the lookout for that. Right now we have 5 flu hospitalizations in Boulder County just in the last week. So it is important to know. This is another reason why it's important to test. Again, when you're sick, stay home. It doesn't matter if it's not COVID, but you can spread the flu, and all of these things are potential burdens on our healthcare system. So this is why we want people to make sure that when they're sick, they're staying away from others. and get tested for the flu in addition to COVID, so you know what you have. There are some antiviral treatments that can be used for the flu, so there are opportunities to kind of lessen the severity there, and especially for high-risk populations. Here's kind of that larger look. I mentioned that we only have 12 staffed ICU beds available in Boulder County, and there are less than 700 beds in Colorado. So 700 may seem like a lot, but that is a healthcare system providing for our entire state population and potentially seeing patients moving in here from states who have even less availability. So again, extreme strain on our healthcare system, which is one of our biggest metrics and what we're looking at. We'll be very interested to see if there's additional treatments. Pfizer has a pill that's under consideration by the FDA. So that will be something. Again, we still need people to be vaccinated and prevent illness, but it is good news, especially for those high-risk folks, that there could be additional treatments that come available. And then finally, I wanted to let folks know, you probably have heard this in the media, but for those folks who've been concerned that Boulder County is imposing restrictions and their peers are not, and how come that is? Well, as you've seen, our rates have stayed below all of our peers, and they're now implementing very similar policies. And in fact, we've seen the mask order adopted pretty universally across the metro area. Pitkin has it, even not in the metro area. Larimer further north, even though they did rescind their vaccine component, but they have the mask order. Jefferson, Adams, Arapahoe, and Denver all have an order almost identical to Boulder County's, and they are implementing the fully vaccinated program like Boulder County is. Broomfield did not adopt the order, but they did require masking for government buildings. So they will likely be continuing to look at this into the future. And again, that effort to work on the regional scale has stayed very active, and it's been positive to see more counties adding additional mitigation strategies to try to bring our numbers back under control. With that, Corinne, I'm happy to try to answer any questions.
Well, first, before we answer questions, apparently you weren't watching the news every second of the hour before this presentation, because the first confirmed case of Omicron was found in Colorado in Arapahoe County. The governor announced it. So we had a bunch of people texting and Q&A and all that stuff in. So it did come out in the news. It was someone who recently returned back from South Africa, and it was a confirmed case, and that person is isolating, and it's a woman in Arapahoe County. So
well, we can change it is likely here to it is here. So that's
yes. So as of 12/2, there is a confirmed case. So that was about 6 of the questions or texts that came in. So I just wanted to start with that. Out of curiosity, what does it mean for Gilpin County's numbers to be suppressed? Is it because they're too low in numbers, or is it?
It's
if you go back to that slide.
Over all the counties. Oops. I will check into that. It might be just an underreporting. It also could be there. I don't know what the hospital system is there, and Gilpin County residents might be more represented in other counties' healthcare systems. I'm not sure. I'll try and find out.
Okay. So the graph on the health department website says there's 75 in the hospital, but it reported 90, and I saw in the news 90. Is it more accurate? Is your data more accurate? Is the data on that website more accurate? Is it 90 or 75?
So these slides were made a few days ago. So, and I think depending on which data slide, it could even be from a few days before that. So what's on our website should be our most current reporting. So that's what I would go with at this point.
Both of them them say updated as of date, and so you're saying you're updated this as of the 29th?
Let me see which slide that was. The hospitalization slide.
Yeah.
I think I have that. Oops.
We'll make sure that we report what day you're updating this as of.
Yeah, the overall, this was last update. This is from the 29th is when that data was for these slides that were created. So our folks are creating all these slides for all of us that are sharing information so that we're all sharing consistent information. But then you are getting a snapshot, so it is not live.
Someone said they don't even have a hospital in Gilpin, by the way. Just
I didn't think they did, but I wasn't 100% sure. So that could be a piece of it. But typically it goes back to your residents regardless. So it's just a matter of where the data is being pulled. If they're looking at residents versus what have you. But for overall rates, that should still be something that is, the information should be available. But I'm not sure why it's not available for Gilpin.
So someone's asking about booster shots. So I want to clarify first off about who's eligible for booster shots. And it's anybody that's 18 or older, who's 6 months past their Pfizer or Moderna, or 1 month past their Johnson & Johnson.
I don't remember if it's 1 or 3 yet. Since
1 or 3 months. It's less than the Pfizer and Moderna. So they're all eligible for booster. All of the providers that are on the Boulder County Public Health website are providers of booster shots, but we're also hearing that it's very hard to get in for boosters.
It is.
And someone's asked, do you have any recommended resources or places to get booster shots?
I don't, other than you may need to be willing to drive further, because I personally have experienced the same thing. I think I live south of Boulder, and the closest appointment several weeks out was in Longmont, so a good 45-50 minute drive for me. So I can't find anything close by myself. So it is a challenge. The demand is very high.
So some of the providers like the Targets, the Costco's, the Walgreens, they'll give you a list and they'll tell you the closest location, the Safeways, the King Soopers, all of those. You might have to drive to get it. The other thing that we have gotten is there are a couple of vaccine equity clinics and a couple of vaccine clinics that Boulder County Public Health has sent me recently. And at the end of the day, if they have vaccine available at the end of the day, you can show up at the 4 o'clock slot. So if the person who sent me that email or that question could email me, because it's anonymous, I will send that email immediately to you on the vaccine clinics. Otherwise, I will send them out with my regular email about the vaccine clinics. I think they're also on the Boulder County Public Health website, the equity clinics in Boulder County. So
I know a lot of the children clinics are offering boosters for the parents when they come to get their children immunized. So there's another opportunity if you do have children of eligible age, that has been something that I know other health departments have also done.
People are putting in, I've found some spots at the Water World, at the Water World site. That was a week ago. So you might have to check, like a lot of people are saying, you might have to be flexible, travel a little bit, go someplace else. I'm even having to travel to get my son a flu shot. I'm traveling, south to get a flu shot because I couldn't get in within a couple of weeks to get a flu shot. So right now it's, I think at that point, it's where we are. Okay, so somebody asked the question, when can we anticipate Moderna being available for 5 to 11-year-olds? But Moderna's not even available for 11 to 17-year-olds, is it?
I don't know that it is. I'm not sure. It might be now. I'll have to check on that. So I'm not all things vaccination. I am promoting them, but our folks that are doing that have a whole full-time job for that. Let me see if I can pull anything up. I thought those Johnson & Johnson and Moderna also had gotten approvals since Pfizer did.
They got approval for boosters of 18 and above. I'm just not sure about the youth. So while you're looking that up, I've got a lot of questions this week, a lot of questions about what's the new definition of an outbreak at a facility. Because it used to be 3 or more within a period of time, but what's the new definition of an outbreak? And what do you do if you suspect you have an outbreak at your facility?
We have outbreak guidance, and I know you've sent this out, Corinne, and so we'll definitely ask you to do that again. That's really what we want you to do, is follow that guidance. You don't need to just reach out to let us know and wait for us to walk you through it. The guidance really is going to tell you what you need to do. And I think on the state website, it even talks about doing it within 4 hours. And so we don't have ability to change that. We're trying to make sure our website is reflected on those things. So you don't need to focus on the communication with us. It's more important that you're taking the action. So specifically looking at excluding those folks that are ill, making sure that they don't come back to work until it's safe for them to return, looking for those other close contacts who could be at risk that may need to quarantine if they're not vaccinated. So really looking at those protocols, areas that could be high risk if the people were working while ill at your place, doing a good cleaning of those. Then after that, as long as you have adequate staff, to cover shifts and things like that, you can continue to operate. But really it's focusing on those ill folks and making sure you don't continue to spread disease within your work setting. So
I think where the confusion lies is when you do go to the outbreak links. So the new outbreak guidance is 5 or more. So that's where, that was a change that was made, but it does say, contact the health department within 4 hours. And then it gives the state site gives your main front desk line. And so we've had a lot of frustrated, trying to get to the epi and trying to figure out who to contact. And so that's why I asked the question today, because people are dealing with, oh my gosh, I've had my first case in 2 years. I haven't had to deal with this yet. And now it's 2 cases. Now it's 3 cases. What do I do? And I'm starting to get those calls again. So yep. What you're saying is let's do the practices we know, the tracing, the isolating, following those quarantine instructions, the cleaning. And you can send an email. You can send an email to the Boulder County Public Health if you need further guidance, but know that they're not going to get back to you within those 4 hours because you have a lot of case investigations going on.
Yeah, and I think we've shown that. I took that slide out just because it's felt redundant, but our ability to handle the current caseload, even though it has dropped from where it was, is dramatically beyond what our staffing capacity is. And we have increased our epi team dramatically. So when we're above 50 cases and we were at 180 or so, 200 per CDC, we're 3 to 4 times what our staffing capacity is. So we don't have people available to answer your calls and get right back to you. So that's why that guidance is so important for you to access and then kind of walk through it yourself.
And again, I continue to send out that quarantine guidance, and because Boulder County Public Health has a chart that says if vaccinated, if not vaccinated, when to test, when not to test, who needs to quarantine, how long to quarantine. I literally have that chart printed up and put it above my desk because I get so many questions about it. And I send it out to everybody on these calls, but I send it out 50, 60 times a week because it is the number one question. Still questions about what do I do? I have, a sick volunteer, but they're vaccinated, but this person's not. What do I do? So continue to go to that site. I know you guys update it as new information comes.
And I was trying to multitask here. It looks like what you had mentioned, that Pfizer right now may be the only available youth vaccine for five up. So kind of all the age demographics, but I don't see anything that Moderna has that approval yet.
All right, as cars are starting in the background right here, I'm going to ask the next question. So we're going to start with what's the difference between a PCR and an antigen test? Because there's a lot of questions about, I'm getting those free Abbott tests. When do those work best? And those are the antigen tests. Those are the ones you can get from the state free. And what's the difference between that and the PCR test, and which one, which is more reliable?
Well, PCR is the best test, but the reason people are doing the rapid test is they want an instant read, so they want to know right away, and those are most useful to find out if you might be ill. So do you have COVID? So when you're symptomatic, that's when you are taking those rapid antigen tests, is when you're feeling ill and you're wondering, do I have COVID? And so if you're worried about, again, am I safe to return? That's when PCRs are going to be even more valuable. They both will diagnose that you have COVID, but you may not be as symptomatic. So the PCRs are going to be more helpful at identifying, yeah, I think I'm better. Am I still sort of contagious? That's when you would want to use the PCRs. PCRs
and
can also be,
the county sites do the PCR tests. A lot of the other places around town, you do the PCR tests. We do have a few rapid PCR testing sites that you have to pay for here in Boulder County. And then we do have a local lab that has approval to you can buy bulk PCR tests that you can drop off at the lab here in Boulder. So there are like take-home PCR tests as well that you would have to drop off at a lab here in Boulder. But those are a little pricier than the Abbott test, that's for sure. Another question that came in though was, will the PCR continue to be the gold standard in testing in 2022? And do you know if they're thinking about incorporating any other tests in that PCR?
I don't know that. That's definitely outside of my expertise. As we get better technology, we'll certainly be looking for that, or as it becomes available for those diagnostic folks. But right now, I don't expect that the testing sites that are being staffed will see a dramatic change, because shifting what type of tests you're doing and how you're doing that takes, all that infrastructure change. So that's a pretty big lift to change what type of testing. That being said, if there is something that becomes widely available that's even more accurate, quicker, all those kind of things that we need in our testing, we'll certainly be looking at it. It's just kind of depends on what comes out. Again, the tests we have now are fairly good. The ones that are being conducted at the free sites, are very reliable. So we have good confidence in the information we're getting. We're also getting the variant typing, which is very important, as we've seen, and as we're continuing to be concerned about new variants like Omicron.
That was my next question, and it's a question that often comes in when we have new variants coming in. What testing sites send off the tests to variant test? Are they just the county sites that then go to the state lab? What tests are then variant typed?
Yeah, I can't speak to all providers who might be providing testing, but our free sites are. So those Mako sites are doing variant typing. And I'm sure there's a huge variety of folks offering testing, and I know you can order your own tests. So obviously at-home tests are not variant typing, often are not even reported. So people that are just doing their own tests are not often even reporting whether they were positive or negative. So, so a lot of that information is not able to be used by public health, but our Mako sites are.
Okay, speaking of the Mako, and then people also use the COVID check and some of those others. What's the turnaround time? We have some people traveling and want to know what the turnaround time is. I've been collecting data on this myself, but what's the turnaround time?
Yeah, I don't know if I can always speak to that. I know that it's been typically within sort of 24, sometimes 72 hours. And it obviously depends on the volume that they're getting and what's happening. Right now, the testing has been low, so I would expect the turnaround times are probably very decent. But it's best to plan for more time and then be happy that you got it much quicker. So don't plan on testing right before you're planning to head to the airport.
But you have to take a test within a certain number of hours before you leave. I know that they don't guarantee it it took me one time 72, but then it took my boss 23 hours to get the test. So if you're really worried about, there are other testing sites that you have to either pay for or build to your insurance or other areas that you can as well, but they don't guarantee it in less than 72. I know on all the paperwork, but we've seen everything from, I've seen 23 hours, I've seen 40 hours. I've seen 72 hours. So I think it depends, like you said, on volume.
Yeah.
All right. I think we're done with testing questions at this point. Why are we requiring children under 10 to wear a mask? The WHO states that children under 11 should not wear a mask for numerous reasons.
Well, the Center for Disease Control is recommending masks for 2 and over. And so they are our national best source of information. I think I showed you that slide. 40% of our cases and outbreaks are from outbreaks in schools. So those are children, many of them under age 11. So we know that's a high risk. 0 to 11 until this last week was our highest case rate age demographic. So we know masks help reduce. They are not 100% effective, but they do provide an additional reduction in disease spread. So that's why we've done it. It's also a pretty benign step, and it's much better to have kids in school with masks than just doing remote learning. So our goal has been, what are the strategies we can use that will have the least impact? It's certainly an inconvenience, but it's not the worst strategy of all strategies that have been implemented over this whole pandemic.
I'm going to reword this question a little bit. How are you working with daycares, especially on the enforcement, when, it's hard to work with little kids to keep their masks up? How is that enforcement being done with some of those facilities?
I don't know that we've had any significant enforcement issues with our childcare facilities. We've been working very closely with them since early last year. We've had staff, we have programs in public health that have always worked with childcare facilities and do routine inspections, for their food service and just how they're operating. So we've worked very closely with the licensed ones, and we've had outreach to unlicensed childcare. So we had significant amount of outreach and calls last year, and there continues to be that open dialogue. So we haven't seen significant issues. We certainly understand if a little kid is pulling off their mask, that's not a compliance issue for the facility. It's when they just don't care and aren't even trying, and we have not really seen that.
This person would like to mention that it's the police department that's coming in and threatening their daycare with enforcement. So, which the police is not public health, but that they're facing some enforcement issues with the police around masking and their use. So.
Yeah, I've not heard any of that, and I am in contact and overseeing our enforcement team, so I haven't heard anything related to enforcement for a childcare facility.
Okay. So can you explain the verified vaccination program, and how if a vaccinated person can, spread, what's really the rationale behind this program? Is it that there's a shorter window that they can spread, what's the rationale behind this program, these facilities, these events, to allow masks to come off in a verified vaccination program or event?
So you can get ill if you're vaccinated. Your likelihood is much less. So that's an important piece. We haven't been showing that slide of the breakdown of cases by vaccination status, but I showed you about 70% of Boulder County residents are vaccinated, but about 80%, the last time I saw the data, of the cases are unvaccinated. So again, only 20-some% of our population is unvaccinated, yet 80% of the cases are unvaccinated. So again, 4 times what you would expect if it was all equal. Similarly with hospitalizations and deaths, that the percentage of folks that are unvaccinated are the 75-80% of those folks, whereas again, they're only 20% of the population. So it's similar to the numbers we've shown on disease, for disparities, in our BIPOC populations and Latinx, where 14% of our population is Hispanic Latinx, but 18% of the cases. So again, unvaccinated are 80% of the cases versus 20% of the population. So it isn't that you are immune, but your likelihood of disease is reduced, as well as the severity of the disease. So it's really that balancing act that we know this is our ticket out of this, and really just dealing with this as an endemic disease versus a pandemic disease. So it's, we've talked about our goals as public health, and one of them is how do we get back to as much of a normal life in a pandemic as we can, and vaccines is really our best option for that, in addition to strategies. Being vaccinated and wearing masks is even better and even lower risk of transmitting disease. But that's really the rationale.
So as part of the VVP program, when you have 95 to 100% of the people vaccinated, you've really reduced the risk of the spread. You've reduced the risk of all of that, and allowed for a little bit more flexibility in this space, because we have a guaranteed 95 to 100% of the people vaccinated in that room.
It is. And we also look at the facility. So we're looking at the overall risk within the facility, and what is the occupancy going to be? Do they have other mitigation strategies like social distancing, which is an incredibly effective strategy? So there's other components that we look at as well, but it's trying to offer that flexibility. I think, our gym and fitness centers are a great example where, people, are inconvenienced and don't like to work out with a mask. So being vaccinated and then still being able to spread out the machines, and then only wearing masks potentially when you're going to be walking around and getting in close proximity, something like that. Those are great strategies, so that it adds the flexibility for businesses. And I know we've seen that from gyms that have moved into that program that may have really not liked it initially, but once they have implemented it, they've seen that their attendance is actually better than they've seen really since there were no orders in place. So again, we're a much higher amount of our community is vaccinated than unvaccinated. So the idea of catering to unvaccinated clients, you're missing out on a lot of people who are not interested in going to businesses because they're concerned about the risk. So
I have talked to quite a few people recently that have started to frequent the site that has all the VVP program recipients on it. And also they're pretty excited that some of the Denver and Jeffco and a couple of the other areas are going to be modeling the same programs. So, Boulder paved the way on the mask, but they also paved the way on the VVP program. Do we have any other questions out there? We had someone also provide you the link on the WHO guidance for children. I know that a lot of the public health that's being followed in the United States is following the CDC, but they did provide the link on children 5 and under in the Q&A, and put that in there for you if you'd like to collect it. Are there any other questions out there? Any other pieces coming in? Do you know why Broomfield didn't do a full indoor mask order?
I wasn't at their council meeting, but all of those go through that process of those boards weighing their decisions. So it isn't just based on what the best public health science and strategies are, it's what politically people are willing to do. So, but I can't speak to why they ultimately didn't do that. I imagine just pressure for them not to do it, not because it wasn't a good idea, because it is, but.
All right, we got that question again. When's this mask order going to stop?
Yeah, it's based on those, the information that I've shared every meeting. So yeah, I think we've showed that we need to be below 50, and we're still 3-4 times that level. So we're still in high transmission, and that's why our healthcare system is really on the brink. And I don't think people understand that. I talk about available beds. But if you've talked to people who work in the hospitals, work in the ICUs, what it's like for them, or you happen to know somebody, unfortunately, that's had to be there for whatever reason, they're really horrific stories to hear about. The state also recently reviewed their crisis standards of care, and that is available. And it's a huge document, but if you're interested in looking at it, you'll get a sense of what's potentially on the table. And it's really frightening to think of who might get care and who might not. That's the kind of decisions that we're very close to being at that point of who gets to be admitted to the hospital and who doesn't, who gets the ICU bed and who doesn't. Those are really horrible decisions for anyone to ever have to make. And the general public is sheltered from that because they don't see it, unless unfortunately they have someone they know who's really in that place. So it's not just about elective surgeries that, you know, are voluntary that don't need to happen. It's way beyond that. It's really about how many people they can care for. And the staff are so burned out because they've been doing this for so long. So it's we're just really at still a very critical place.
So to clarify, and it's 50 per 100,000. We have to get to that point, and we have to be there for 21 days before the mask order goes away.
Yeah, and what it does is it removes our mask requirement, and in the event that we would start to surge again, it would come back. So the order is in place. So we have not rescinded it when that happens. We have a clause, that metric that we're following of when we would feel comfortable relaxing masking. That being said, you know, the state mask orders were lifted when we were even at lower rates than that. And we were still concerned about, well, this could still surge back up. And it certainly did. We didn't necessarily expect the Delta variant, but we were concerned about variants, and we always have been. And so that's really the risk. I think the more people can normalize this and just deal with it, it's definitely an inconvenience, but it's nothing more than that. It will really help our healthcare system even moving forward. You know, it helps with seasonal flu, it helps with COVID, it helps with all the respiratory diseases, which there's quite a few out there.
So when we talk about the 75 or 90 in the hospital, it's not really just about the COVID patients in the hospital, it's about all patients in the hospital. And this is flu season, this is a high peak season for hospitals. So we're looking at total number of people in the hospital. When you report, a lot of times you're reporting the number of COVID patients in the hospital, but we have a lot more people in the hospital for other reasons.
Yeah, when we have 12 ICU beds available, that's for anything. That's people who get in a severe car accident, who have a stroke, who have an appendicitis, who have severe COVID. You know, they have 12 ICU beds, period. It's not just by disease. This is really what the healthcare system has complete capacity. So that's very concerning.
All right, and then finally, can you talk a little bit about the logic behind being able to take your mask off once you've seated at a restaurant and you're able to eat and socialize at your table with your mask off? How this makes sense in preventing the spread?
It is not a strategy to prevent spread. It's a strategy for getting back to normal life. So it absolutely is not a strategy to prevent disease. You're increasing your risk when you're amongst other people outside your household, especially if you're not social distancing and taking off your mask. Those increase risk. So that's, I think, a little bit of give and take, but it absolutely is not a strategy to reduce illness. That being said, the School of Public Health has been looking at, they did a case control study, so trying to identify what are greater risks. And I will say that, you know, that report will be out. They did show that the staff working in restaurants are 4 times more likely to get COVID. And that's likely because of their exposures to all these people who may be unvaccinated and are unmasked, and then they're in close proximity. So that's another reason why we really would encourage restaurants, even though your patrons don't need to be masked, to look at vaccine verification programs. I think you will see that it'll increase your business, and it certainly will protect your staff.
There's also the social factor of people getting together outside of work and they take off their mask at that point. And there's all of those pieces that we have to take in. It's got to be a pretty hard study to do. So I think a lot of people are looking forward to seeing what comes out of that Colorado School Public Health study. I know you need to get out of here because you have another meeting. I don't see any more questions. At this point, we will have another session before the holidays. It is 2 weeks from today at 1 o'clock. I will send it out in the email. The recording for this one will be available if you weren't able to make it, and all the resources provided including the links to booster clinics and youth clinics and outbreak resources and quarantine resources. I send every time the funding resources, it's one link, but they continue to put new funding resources on there as new funding resources become available under all of the legislation and all of those pieces. So just keep going back to that link. And if it's new, I often highlight if there's new resources. Thank you very much for joining us. Thank you very much for continuing to get the information you need to get to your staffs, to yourselves. And if you have any questions, please feel free to reach out. Have a wonderful day, Lane, and have a wonderful day, Boulder business community.
Yeah, thank you all for joining.